Good afternoon. I am here with Dr. David Garcia at Polaris Rejuvenation. Today we are going to discuss Peyronie's disease. How are you, Dr. Garcia?
Very good, thank you.
Good. Dr. Garcia, I have a question for you.
Sure.
The first question is, what exactly is Peyronie's disease?
Well, Peyronie's disease is an affliction of the penis where there's fibrosis, otherwise known as a plaque or a scar that occurs in the penis, which causes a bending of the penis with an erection. So with an erection, the penis can actually bend at an angle, and that can cause pain, and as well as issues with sexual intercourse. So it can be an issue for men.
Okay. And what are some of the known causes for Peyronie's disease?
Well, Peyronie's disease is caused, again, like I said, by fibrosis, which occurs in the penis, a scar tissue in the penis. It's right underneath the skin. It can be in a localized area, it could be the whole shaft of the penis. And it's usually caused by either trauma to the area, or a athletic injury to the area, where the body goes and heals itself, makes a little scar underneath the skin. But many men never realized deny they ever had any issues to the area and still have Peyronie's disease.
Okay. So what is the prevalence of Peyronie's disease?
Well, there's controversy on the prevalence. Okay, the Urology Foundation states that about 6% of men do admit to Peyronie's disease, and usually it's between ages 40 and 70. Excuse me. But the Albert Einstein Medical Center states about 44% of men do admit to erectile dysfunction. So taking that into account, the incidence may be actually underreported. So again, there's controversy on the prevalence of Peyronie's disease.
Okay. And so I guess my next question then, what are some of the common symptoms of Peyronie's disease? Are there signs and symptoms for men to be able to determine whether or not they have Peyronie's disease?
Well, Peyronie's disease is, again, it's a curvature of the penis with erection. And most of the time it's an upward. The penis is angulated going up, but it can go south as well, or it can angulate to the left or to the right, a sideways angle. But the vast majority is going up. So that's only with erection. And it can also be associated with pain with erection. So you can have erection with angulation and with pain. And sometimes you can feel a nodule underneath the skin. They can feel right underneath the skin along the shaft, and those are all symptoms of Peyronie's disease.
Can Peyronie's disease cause any other illnesses?
Well, it's associated with other illnesses. It can be it's a higher prevalence with people who have diabetes or obesity, high blood pressure. Those are associated with Peyronie's disease. Now, it's also can cause other issues. For example, if you have fibrosis in the penis, you can actually it can go around the nerves, so you can have issues with nerve sensation in the genital area, the penis itself. So that can be an issue. Sometimes the fibrosis can circumferentially go around the penis, so that you can actually have a stricture or tightening of the urethra, the urine tube, where you have difficulty with either ejaculation or urination. And then you can have a systemic illness as well, causing fibrosis in other areas, such as the hands and the fingers and the palms, causing deputans contractures. So you can have fibrotic areas causing contracture of the feet or the fingers. And that's more of a systemic illness, and it can also hit the penis area as well.
Okay. Now, are there any psychological effects associated with Peyronie's disease?
Well, if men have an issue with an angulation of the penis that's associated with pain with intercourse, that can cause distress. And so 80% of men who do have Peyronie's disease do admit to depression and distress with that, pain with, and this is also associated with pain with intercourse, so that at the end you may want to just not want to have intercourse, and that can have issues also with relationships as well. So yes, it can cause an emotional and psychological toll. Yes.
Okay. Now, my final question for you this afternoon, are there any actions that can be taken against Peyronie's disease, maybe to help prevent Peyronie's disease?
Well, there are actions that can help fight Peyronie's disease, because left untreated, it's going to stay the same or even progress, right? So some doctors do recommend either medications or injections or even surgery to to soften the plaque or remove the plaque. But fortunately, there is an advanced technique using high-frequency acoustic device to help break up that plaque. That's the Gaines wave treatment, and that's what we do here at Polaris Rejuvenation. The sound waves do break the plaque over time, and it leads to a softening effect and a straightening of the penis. Now, you can accelerate that with PRP injections. These are your body's own natural regenerative proteins, which are reintroduced into the area along with the Gaines wave acoustic treatment to really enhance and accelerate the breakup of the plaque, to straighten out the penis and have a better lifestyle, better sex.
Okay, thank you very much for the expertise on Peyronie's disease. I appreciate you taking your time answering questions with me today.
Sure. Thank you, Dieter. Thank you so much. Take care. Have a good day.